Lesch Nyhan syndrome is an X-linked recessive disease caused by the absence or mutation of the HPRT1 gene on the long arm of the X chromosome. Hypoxanthine guanine phosphorybosyl transferase, HPRT for short, is an enzyme that allows the cell to recycle purines, ensuring cells have enough supply of these building blocks for the production of DNA and RNA. People who have this disease lack this enzyme, so their cells are unable to recycle the purines, so they are degraded and excreted as uric acid. Our bodies receive purines from certain foods like shrimp, organ meats, and beer. Other factors that also are associated with this disease are neurological disabilities and behavioral problems. The excess uric acid in the blood leads to having many symptoms one would experience if they had gout. As early as 6 months, symptoms like orange-colored deposits in diapers from the increased level of uric acid in urine, as well as kidney stones causing blood spotting, can be seen. Neurological symptoms that a child may show are involuntary movement, poor speech, and facial grimacing. Between the ages of 2 and 3, 85% of cases also show symptoms of self-mutilation, including scratching their face, banging their head, and biting fingers. Neurochemical and neuroimaging studies have shown that abnormalities of dopamine neuron function in the basal ganglia may cause these behavioral abnormalities. Older patients exhibit tophi, which are deposits of crystalline uric acid found at the surface of joints in the skin or cartilage. This may restrict some movement. Lesch Nyhan syndrome most always occurs in men, while women are the carriers. This is because men only have one X chromosome, therefore one allele of each gene, whereas women have 2 X chromosomes, and the one without the mutation will be expressed since it is dominant. A mother who is carrying the mutation has a 25% chance that her daughter will also be a carrier, and a 25% chance that her son will have the disease. It is a fairly uncommon disease, with only 1 in 380,000 having it. Patients usually only live until they are 30 or 40, usually dying from lung infection, kidney stones, kidney failure, and other unknown causes. Patients can be diagnosed through clinical evaluations, blood tests to see if there is a high amount of uric acid in their blood, and looking at their family history to see if anyone else has had it. Gene testing can also be done to look at the HPRT1 gene, along with enzyme testing in pregnant women to see if their baby will carry the disease or have it. Nothing can be done to prevent an individual from getting Lesch Nyhan syndrome because it is a genetic disease. However, medication can be taken to lessen the effect of some symptoms. Allopurinol is a common drug taken by gout patients because it controls the excessive amount of uric acid produced in the body. This will reduce the symptoms associated with it, like tophi. Large kidney stones can be treated with the use of extracorporeal shockwave lithotripsy, which uses shock waves directed at the body where the stones are. This will dissolve them into smaller pieces so that they can easily pass through the urinary tract. Although no sustained treatment is effective for neurological problems, benzodiazepines and counseling have some effect. Children who self-mutilate are usually put in restraints and wear mouth guards to stop them from biting and hitting themselves.